uh, bronchiolitis, and this is the first topic of the lower respiratory tract infection. And as you know, I think this is a viral infection, and in which there is inflammation in the uh, lower respiratory tract, especially the small airways like bronchioles. And the most common age is below the 2 years, but it is most common in first 6 months of the life, especially around the 6 months of the life. The patient has this more, and it is common in the winter seasons. What are the signs or symptoms? Regarding the signs or symptoms, the patient initially has cordial symptoms like flu, mild cough, and he has low-grade fever. But later on, the patient has typical signs of the respiratory distress, in which there is tachypnea, there is a tachycardia, and there is other signs of the respiratory distress, like flaring of the LINAC, and there is a subcostal and intercostal section. There is child may go into the apnea, and child is unable to maintain the oxygen saturation. And when you will examine the chest maybe it's a hyperextended, and the child when you will auscultate his chest, maybe there is a prolonged expiratory phase, and the child has tractus as well as the expiratory wheeze. Along with this, if you will find liver is enlarged. So these are some signs and symptoms, and when you will check his oxygen saturation, maybe it is below the normal. Now we are discussing about what are the risk factors for bronchiolitis. The risk factors are: number one is a child who is born preterm and who develops bronchopulmonary dysplasia. The other name is chronic lung disease. I want to tell you here a definition. What is when you will say that he is a chronic lung disease? When the child is on the respiratory support, on the oxygen, with or without ventilator for more than 4 weeks, this is called a chronic lung disease, and these children are more prone to infection, especially this bronchiolitis. The other group is a child who has congenital heart disease, either cyanotic or acyanotic. So these patients are more prone to bronchiolitis. Now we are discussing about differential diagnosis. The differential diagnosis are especially recurrent viral-induced wheeze. Maybe this is early signs of the pertussis, early signs of the asthma, and maybe this is the cystic fibrosis will initially present with recurrent chest infection. So these are some differential diagnosis. What investigation you can do? The most important investigation is oxygen saturation. The others are, if you will suspect that there is a bacterial infection, then you will go for full blood count, inflammatory markers like ESR and CRP, and you will go for a blood culture. When you will do a chest X-ray, when you will find any local sign, any signs of consolidations or fever, any signs you will find that this patient may have emphysema or pneumothorax, or when you will find any cardiac murmur, then you will go for chest X-ray. Otherwise, in routine, no need for investigations, because the diagnosis is totally clinical. Now, how do you manage these patients? The management is a very important. You should, first of all, keep isolate the baby. But before this, I want to discuss what are the indications of admission in case of the bronchiolitis. So, admissions are: if the child is respiratory distress, is the signs of the respiratory distress, like if the respiratory rate is more than 60 and there is the signs of the subcostal or intercostal recession, child is not maintain his oxygen saturation at room air, or the child is not able to take feed up to 70% of his requirement. If what I mean, if child is less than 70% of his requirement, in these conditions, there is indications of the admissions. Some other relative indications of the admissions: if the child has risk factors, as I discussed about before, the child has congenital heart disease or chronic lung disease, or if the parents are not satisfied, or a child came from a that area where the emergency hospitals are not present. At these conditions, you can also admit these patients. Now, after admission, what is management? First of all, you will keep this baby isolated. This is a very, very important, because this condition is highly infectious. So you will keep this baby isolate, then either isolate in the cubicle, or you will put these babies with the same diagnosis, and this cubicle is near to the nursing station. Okay, then ask the medical staff, they should wear the gown, they should wear the hand gloves. So this is regarding prevention of this infection to other people. Now, the management is, let me to tell you here that there is no role of any antibiotic, no role of antiviral, and no role of no role of steroid, no role of the nebulizations, only given oxygen. So what is the protocol now regarding oxygen? If you see the baby is oxygen saturation is below 90, so you will put oxygen with face mask. The humidified oxygen is more preferable, so you will put on face mask oxygen, and if child is not maintaining, then you will give him a nasal oxygen with a dose of 2 to 20 liters per minute. And if still the child is not maintaining oxygen saturation, then you will close monitor, and then you will put on the CPAP or BiPAP so that you will sequence airways, and he will take his respiration, further respiration to the machine. So you will put the CPAP or BiPAP. Okay. So what are the complications of this condition? The complications are maybe secondary to bacterial infection, or the most important is bronchiolitis obliterans. It is a very rare but very dangerous. So this is one of the complications. Other than this, it can lead to sepsis. It is more dangerous. A child who is under 6 months of age, it can lead to apnea. Okay. So these are some complications. Now, something I want to tell you about, because maybe they will give scenario regarding the vaccinations, because the most sorry, the patient is taking So what are the indications of the discharge? The indications are patients who are taking already well, more than 70%, our patient is a no apneic spells, our patient is maintain his oxygen saturation without oxygen supplements. So these are some indications that you can discharge these patients. And if the parents are satisfied, this is also a very important thing, if the parents are also satisfied, then you can discharge these patients. And what is the follow? And regarding the follow, if the patient is during the admission he went to the ventilation, or if there is any signs on the chest X-ray, consolidations, or if the patient is expiritum, in this condition the follow-up is to the hospital. In other cases, the follow-up is only to the GP. So this is all about the bronchiolitis, and any question you have, you can ask without any hesitation. Thank you very much.